Good evening. Welcome back to another edition of Ask Me Anything. Tonight, we have some great questions as always. For those that are new, welcome. I'm Dr. Twyman, board-certified cardiologist who helps people reduce the risk of having a heart attack and stroke. If you're potentially interested in working with me, I have a practice in St. Louis, Missouri, Apollo Cardiology. I work with patients from all over the country and worked with somebody from overseas today. So we do have telemedicine capabilities for those that come to see us, at least for their initial consultation. So 2 pieces of housekeeping tonight. One is if you're looking for more in-depth knowledge about vascular health, my school community is the place where I'm doing most of my teaching these days. There's a free 7-day trial. It's drtwyman.com/school, spelled SKOOL. Right now I'll be doing another live Ask Me Anything this Friday, 1 p.m. Central Time for those members. And it's via Zoom, so I get to see your faces, and it can be a back and forth type of Q&A. And last time patients were asking about their lipids, their coronary scores, so a little bit more in depth because I can go back and forth in that format where Instagram doesn't really allow me to do that. So if you're interested in that, it's the school community, drtwyman.com/school. Second piece of information, the Canyon Ranch Retreat, the itinerary is now out. So for those that have signed up to join us, I'm looking forward to meeting you in person. I'm getting ready to still do my hike for Kilimanjaro next year. So I've been doing a lot of hiking the past few days. And there's some great level 4 hikes in Arizona if you're interested in joining those. So if you haven't seen the emails from me, please check your email. Make sure it's not showing up in the spam folder. But I have some details on how to stay in touch through our Telegram group, where I'll be releasing what I'm doing those days and trying to do some meetups to do some live events while we're there. Maybe some show and tells with some of the gear that they have in the biohacking lounge at the Canyon Ranch. So if you've signed up and haven't heard from me, please check your emails. All right. With that being said, we'll jump into the questions tonight. So 80-year-old female using the Connect UT. This is a home blood pressure device that also measures central aortic blood pressure, which is the blood pressure that your heart, brain, and kidney sense. They report that their brachial blood pressure over the 3 months has been averaging 130 over 78, with the highest of 159 and 96. So that is stage 1 hypertension. The goal is to have a blood pressure less than 120 over 80. So lifestyle-wise, the DASH diet, the Dietary Approach to Stop Hypertension, is the diet with the most data behind it. It's very akin to a Mediterranean-type diet. Exercising for at least 150 minutes a week. Then working on stress management if that's an issue. So meditation, deep breathing exercises, biofeedback, and sleeping well. So you generally want to sleep at least 7.5 to 8 hours a night. If you have snoring, apnea spells, then you have to get that treated. If you don't sleep well, you're not going to have good blood pressure. Then it depends on how well your nitric oxide pathways are working. You can test out with salivary test strips. You can get blood work that looks at uric acid, homocysteine, ADMA, SDMA. And then there are various nutraceuticals and pharmaceuticals needed if you can't get down with lifestyle. Does a calcium score of 136 warrant a statin if cholesterol levels are within normal range? So take it as 2 pieces of information. A calcium score of 1 to 36 depends on your decade of life. If you're 40 years old, that would be a very high risk finding. If you're 80 years old, it's an expected number. Not high risk, but not optimal. Optimal is still having 0. And I've seen patients in their 80s with scores of 0. I've seen somebody under the age of 40 with a score of nearly 1,400. And I've seen a 7,700 to give people a perspective on the range. More calcium, more plaque, more risk of cardiovascular events. So a score less than 400 is considered not high risk, but is abnormal. Cholesterol is just one part of the story. So you have to have a healthy glycocalyx, low inflammation and oxidative stress, and optimal lipoproteins to really reduce the risk of further plaque buildup. Think of statins in this case as more of plaque stabilizers and potentially lowering inflammation if you have inflammation. It may not be the main thing that you're lowering lipoproteins with it if your cholesterol levels are normal. But it's really about ApoB being under 70 and optimally 55 for people who have more vascular risk factors. What is the connection between artificial sweeteners and heart palpitations? This is not an area that I'm well versed in. I try to eat as many whole foods as possible. I try to minimize artificial sweeteners when possible. Some of the protein shakes and protein bars may not always be artificial sweetener free, but try to keep it to either stevia or monk fruit, which is not necessarily artificial. But if you're eating something that is continually giving you fluttering in the chest, keep a log and figure out if there is an association between the types of artificial sweeteners you're eating. A criticism of modern medicine is that it treats symptoms and not disease. How do I respond? Well, that's probably only partially true. Western medicine is really good at taking care of you if you're injured in a car accident or having an acute myocardial infarction. So those symptoms need to be treated with modern medicine. But if you're asking how well does modern medicine do to prevent asymptomatic disease, well, that's where they may fall short at times. Because if you don't have symptoms, you often don't present to the hospital or ask a doctor for a further deep dive. And people who are more proactive, they're the people that I'm searching out for. That's why I do these Instagrams, is to find people who are more interested in preventing things and not waiting for them to become symptomatic. Cardiology, by the time you become symptomatic, particularly with chest pain, shortness of breath, or exercise intolerance, you often have a 70% stenosis in one of your coronary arteries. So not too late to the game, but you're getting there. So I wouldn't say it's necessarily a criticism. Modern medicine has its role, but your lifestyle dictates the outcomes. Medicine's there when you get banged up and you don't have a way to put yourself back together. This is a mixed question because there isn't one. So the best diet for somebody who has coronary artery disease. This is a complicated topic because if you've listened to my content in the past, you know that there's not one specific diet. It depends on your mitochondria, depends on where you live in the world, depends on the season, and it really depends on how well you basically metabolize fats. Also does matter if you're insulin resistant or insulin sensitive. If somebody wants a generic answer, I don't usually give generic answers. A template that would work for many is a Mediterranean type template where you have the green leafy vegetables for the nitrates, you have the seafood for the DHA, you have olive oil for monounsaturated fats. So it's a template for people, but you're going to fine-tune it based off of how well they absorb the fats, which you can look at on the cholesterol balance test and the fatty acid balance test on the Boston Heart Lab panel. And then you could look at the person's A1C, their insulin, C-peptide, adiponectin levels, HOMA-IR score, see how well they're metabolizing the carbohydrates that they're eating. All right, so I think those are the pre-submitted questions. So let's jump into the comments. What's the chance that rosuvastatin or Zetia will raise AST or ALT liver enzymes? I don't have an exact percentage. It depends on what dose, but I definitely have seen increases in transaminases if somebody is using high-dose rosuvastatin and ezetimibe. Often if you hold one or the other, the transaminases generally get back to normal. Typically don't get too concerned unless they're at 3 times the upper limit of normal. So generally if the AST and ALT are under 120, you just hold one of the medications and let the transaminases drift back down. And in those cases, the person can't tolerate dual therapy, then you may switch them up to a PCSK9 inhibitor. Views on glutathione, it's critically needed. The liver produces it. You can monitor GGT levels, gamma glutathione levels. It's on the blood test that looks at liver function test. If your GGT is normal, you generally have normal levels of glutathione. If people eat foods high in cysteine, then that is a precursor to becoming glutathione in the liver. That's my preferred way to optimize glutathione. If you supplement with glutathione routinely, you'll downregulate your body's production of glutathione potentially in the liver, and then you become more dependent on it. If you stop your glutathione, you are at more risk of oxidative stress. So you may have bought yourself a lifetime supply of glutathione if you take it too long. All right, so this is a question I'll answer generically. I can't tell a patient, via Instagram what to do. It depends on what your doctor is discussing with you. But can you stop taking statins? Yes. Sometimes people stop them because they're having side effects such as muscle pains. Some people have issues with their liver function tests increase too much for the doctor's comfort. Some patients have issues with their glucose levels increasing, and then they stop the statin or switch the type of statin, and the numbers improve. So, do you need to taper off? No, not necessarily, but if you're using it to lower risk, and you can't tolerate the statin for any reason, then what are you going to switch it out to? You're going to switch it out to ezetimibe, Repatha, Dexatal. You're going to do some type of nutraceutical option. So, generally want to have a plan of when you come off, what are you going to replace it with? All right, so this is a question where I can again only give you kind of generic information. I can't tell people exactly what to do with this, but somebody says that they've been struggling with some chest symptoms due to long haul COVID. What would I recommend or consider doing for people who have symptoms? My area of expertise is endothelial health, vascular health. Long haul COVID does have a component for damaging the glycocalyx, the lining of the arteries. So if you have abnormal pulse wave velocity on a max pulse or a test at home that can tell you your pulse wave velocity, if you have elevated blood pressure over 120/80, those are signs and symptoms you may have some microvascular disease. If you press on your fingers and it takes a long time for the blood to return to your fingers, so if you press on your finger and it's white and it doesn't get back to pink in a second or two, you might have some microcirculation issues. So may need to support nitric oxide. There are supplements that can do that. Optimize the glycocalyx, so remove any other insults to the lining of the arteries. There's supplements that can support the glycocalyx. You need optimal infrared exposure, so sun exposure, sauna exposure, grounding potentially to help with structuring the water in the glycocalyx, and then working with generally a functional or quantum doctor that has some experience treating patients with long haul COVID. All right. Well, that appears to be all the questions asked in the comments tonight, and they're great as always. So I appreciate your guys' time and attention. I will be back as always on Monday, 6 p.m. Central Time to answer these questions. If you're looking for more of these type of Ask Me Anythings, I'm going to be doing a longer form one this Friday, 1 p.m. in my school community. It'll be via Zoom, so people can go back and forth, asking me questions and clarification on anything that we discuss. And then people get to learn much like this, where they learn from others' questions. If you're interested in that, it's in my school community, drtwyman.com/school. There are courses in there, how to read your labs. There's courses in there how to ask doctors about what test to get to look at your vascular health. So if I'm not your cardiologist, what tests you should consider looking at to minimize your risk of having a cardiac event. It's all listed there in the school community. So again, appreciate your guys' time and attention, and I'll see you next Monday night.